So I finally saw sports medicine doctor, Dr. Kadavi. He did a couple of injections, but it's been a couple of months since the injections now. I'm starting to notice the pain starting to come back. And after my son was born 5 years ago, it just became more difficult to manage everything with the brain fog. The first week of having the orthotics on, seeing almost 50% improvement, I was very happy about that. I had a bit of unrealistic expectations because I would see your 10-minute patient videos and kind of expect an immediate result. So it's met my expectations. Like I'm pain-free. I can focus on work. Yeah, my name's Jason Ko. I am 35 years old. The symptoms that I deal with the most the biggest one is brain fog. I can't think clearly, and it affects every area of my life, particularly the work that I do, which is all in front of the computer. Yeah, I feel like I've been dealing with this ever since I got out of college after a few years, and then it was very hard for me to focus at work, and I compensated with lots of caffeine. And after my son was born 5 years ago, it just became much more difficult to manage everything with the brain fog. I think it's like a 8 or a 9. Well, lately it's been a lot better since I did see other specialists that helped with my back pain a lot, and that seems to correlate with the severity of the brain fog, but sometimes I still get it. So is the back pain. Yeah, I think it got really obvious that I have bad back pain starting 8 years ago, and it's all on my right side. From the top of my neck to the base of my lumbar, and it's all on my right side. It's very tight all the time, and then it got very difficult again after my son was born and I was carrying him all the time. I mean, there have been a few more acute injuries, but nothing back specific, nothing I had to see a doctor for. I had a pretty severe bike crash as a teenager, played football during high school. We weren't really taught to hit properly, so I just jammed my head in my opponents. So that may have something to do with it. When I first started, maybe 8 years ago, it was just very difficult to stay seated in the office. We had pretty nice office chairs, and we had an ergonomic specialist come out to adjust my specific setup, but none of that helped. I saw chiropractors for years. They did provide, when I worked with a good one, I was pretty pain-free, but then when he moved away, all the pain came back, maybe a day or two. And the worst that I got was, it's a 10 out of 10. I was, traveling to China to visit my in-laws, and we were gonna go on a hike, and it was like the first night being there, and I slept on a very hard bed, which is very typical in China. And I just woke up, I was in pain, I was screaming. So I finally saw a sports medicine doctor, Dr. Kadavi. He did a couple of injections, hydrodissection to loosen up the fascia in between my upper shoulder muscles. He did a platelet-rich plasma injection all over my right side of my back. Those helped a lot. So it took me probably from a 9 to 10 down to like a 2 or a 3. But it's been a couple of months since the injections now. I'm starting to notice the pain starting to come back, and the expectation was, it should have been fixed, basically. But those injections, I think in the end still only was to heal the symptom, but so that showed me there's probably something more of an underlying issue that I'm dealing with. So that's when I reach out to you. Yeah, for my back pain, it's probably a 2 and a 3. If I continue to do my physical therapy, recommended exercises, it's manageable. Daily, I don't do it as well as I should. I probably do maybe 5 minutes worth. Since those injections, probably 4. Yeah, I sleep very poorly. I toss and turn throughout the night. Falling asleep can be troublesome too, because the moment I lay down on my bed, my neck wants to tense up, and it's very hard to fall asleep because of that. And if I do fall asleep, I tend to get woken up pretty easily. and then sometimes I manage to fall back asleep, or sometimes I don't, and I'll just get up at 2 a.m. and get on my day. You know, with a kid, I have to get myself up, so I do think I'm on a 1 to 2 on a daily basis, and I do wake up tired, irritable. I don't feel refreshed. And no, there have been times where I slept less and I actually felt better throughout the day because my back wasn't in a tense position for that long. So I've actually experienced that. So sleeping longer has sometimes caused me more back pain waking up. My symptoms also on my right side here, but I experience it on both sides. It's more severe on my right side. This ear, when I hear things, it's like I have a stethoscope on me and someone's pounding on it. That's how I hear things. Even just the sound of putting a cup down, that's a little loud. That would make it sound like someone is pounding on my eardrum. So like in the morning it's worse, and if I'm preparing scrambled eggs, the sound of the fork hitting the bowl is very... I've dealt with this since college. I distinctly remember. And another symptom that I have is every time I swallow or just talk, it constantly pops. The thumping is painful. It feels a little bit like a spasm too. The cracking is more an annoyance, and I've come to get used to it. I live with a 7 to 9 on a daily basis, and it's 7 and a 9 in the morning. As the day goes on, it gets a little better. To maybe like a 5 to 7. I saw another ENT when I think it was maybe 5 years ago, and we even did a hearing test, and he said my hearing is perfect. I told him that's the problem, I hear too well, but he was trying to diagnose me with misophonia, and I disagree with that, because the moment I have an earplug on one ear, I'm much better. Misophonia is a psychological overreaction to sound. So like someone chewing gets you really angry, like that. It does, but I think it's because I deal with this thumping sound. I wouldn't say I'm not nuts, but
I'm saying it's like.
But I disagree with his diagnosis.
Arms all the way up, a little bit higher. I'm going to push down, don't let me. Bite down tight. This is the best you can. Bite down, bite down. Bite down. One more time. One more time, bite down tight. It's pretty strong back. Lean against the wall. Have your feet out a little bit. So that you're like this. Back is supported, you can come out some more. Yep, so that your back is supported by that. I'm going to use the same amount a second ago. Bite down tight. Nice open, nice open. One more time. About the same. Away from the wall, stand here. And let's change your jaw like the one. Just a second, give me a second. Now bring you to the middle position. Perfect. Arms up back. Alright, I'm going to push down, don't let me. Just 4 fingers. I'm going to have to use my weight. Right down tight. I'm 180 pounds. I'm hitting on you. I'm hanging from you. Not budging. Stay put. Don't move. Open again. Take away the magic thing. Arms all the way out. And I'm going to use the same amount a second ago. Bite down tight. I need to even use all my weight. Bite down tight. That was about at least 15. Big difference, not a little one. All right.
Overall, I'm seeing improvements across the board. No symptoms got worse. The first week was pretty miraculous. So I saw a lot of improvements, and then the past week, I felt like during sleep my jaw is fighting to get back into its old position, and then I would get woken up. And so some of the symptoms have come back, but overall still, if I'm looking at today compared to before starting the treatment, overall I think I have a 20% improvement. Yeah, I slept well. the next morning I was able to wake up and make breakfast without any issue or irritability. I also wasn't stumbling around like someone who just came out of a bar. I had a lot more energy, so it was a big improvement. Yeah, like 50%. My ear, I would hear a thumping sound whenever I hear anything, even like the sound of putting a glass down on the table. And that's a huge improvement. It's like 50%. Like now I can snap next to my ear and I just hear my snapping instead of like a drum beating. Yeah, you know, I would say 40%. I drink less caffeine now. Before I was drinking like 4 to 5 or 6 cans. Now maybe I'm down to 2 or 3. And then, so that's a pretty big improvement. And then the past few days, the symptoms got slightly worse. It's still better than before the treatment, because again, my jaw is fighting to keep the status quo. But overall, brain fog is improved. My work performance is better. So overall improvements. I can do deeper levels of thinking, right, and make important decisions on the fly instead of having to wait until the right time when my brain is clicking. So that's a big improvement. I would say with how the past 3 days have been, a 20% improvement. Yeah, I think it's also about a 20%. It's largely dependent on the back pain that I experience, and so that's had a pretty good improvement. I don't have pain in my traps anymore. Before I was waking up like a 2 out of 10 in terms of energy. I wake up now maybe like a 5, 40% from like waking up. Before seeing you, I had pain in my trap and also pain in my thoracic all on the right side, and now it's just mild pain on the thoracic. My trap pain is mostly gone. It's very mild tightness, but no pain, doesn't cause any discomfort really. 30%. I'm doing pretty good. Overall, I would say there's like 50-60% improvement in all of my symptoms. My symptoms are a lot better. I don't have an earplug. Some days I don't even remember I have that issue. Today I have some of it, but it's not too bothersome. And what helped a lot too was cutting out caffeine. And I think it finally allowed my body to relax and adapt to the new bite. Because one thing I was struggling with was when I was sleeping, it would clench in the old jaw position. It was like my body was fighting the orthotic. Then once I went caffeine free, I stopped experiencing that, and I started rapidly experiencing improvements in symptoms. Yeah, the first week I had this in, I noticed improvement. I would say like 50% improvement. It was pretty miraculous. And then I had the bed bugs from probably from old furniture that I got. In the ear symptom, 70%. I would find it very difficult to focus at work, but now it's I would say there's like a 70% improvement too. I find myself having days where I could just work all day without an issue. Yeah, all the symptoms. When the symptoms flare up, it's all very bad. Back pain, ear pain, brain fog. It makes it difficult to figure out a solution to maybe my son's irrational thoughts and behaviors. Yeah, so it sucked a lot. 80% improvement, yeah. Yeah, before I would wake up and feel even more tired than before sleep. Now I wake up, I do feel more refreshed. I would say 70% too. Before I felt like my back was very prone to spasms and feeling very tight. If I just sat wrong for a few minutes, I would be in pain for the rest of the day. If I slept poorly or slept on the side or just slept, I would wake up with back pain. And I noticed my head is not sticking out, so my neck is a lot more relaxed. And when I go to sleep, I don't feel it tightening up, so I can fall asleep faster too. 70%. I saw a lot of the other patient videos of yours before deciding to move forward, and I would say my expectations were quite high. And the first week of having the orthotics on, seeing almost 50% improvement, I was very happy about that. It was a little bit of a roller coaster. I was expecting a lot, got that the first week, then it regressed, lost what I got. Then, now I'm in a much better place than before the treatment. So, meeting my expectations. Yeah, overall I feel really good compared to how I came before. And I feel a lot more alert and just able to take on challenges in life. Overall 80% improvement across the board. Yeah, before it was, the kind of symptom I would experience is if I put a glass down or just make any kind of noise, my ear would spasm out. And now my symptoms with, along with the help of humidifiers in my office and in my bedroom, my symptoms improve like 80–90%. Yeah, I mean, I can't blame a 5-year-old boy for being loud, but having the symptom made it really hard to spend time with him. I would have to have an earplug on at all times. So now I feel back I feel like I'm back, and so I feel pretty good about myself now. 80%. I don't even know what else would change to make it to 100%. But I feel really good. I can focus at work for several hours at a time. Maybe it takes a little bit to get into the flow of work, but once I'm in it, I want to stay working, and I get a lot more done during the day. Yeah, before I would sleep terribly, and I would wake up multiple times a night from the back pain, from ear pain, and then that would just affect everything else the rest of the day. So now I'm completely off caffeine, and I've been able to stay off caffeine. That's the tricky part. Before maybe I would have a good spell and I could get off caffeine, and then my symptoms would flare up. I would sleep really bad, and then my brain fog would be bad, and I would have to get back on caffeine. But now I've been able to stay off it pretty easily, and it's had a big improvement. I wake up, I'm ready to take care of my family, ready to work. Yeah, again, I would say 80%. Yeah, so I would be in such pain before where I would be bedridden for almost kind of most of the day and get up only as needed. After having the orthotics in, I just felt like gradually my back relaxing, and I could have bad posture once in a while and not have crippling pain the rest of the day. And yeah, the overall quality of life is just drastically better. 80% too. Okay. I think I'm just nervous to say I'm 100% better. But I mean, in some of the symptoms, I could say that too, right? But I think I'm just a little nervous to say. And overall, the orthotics, it's been a 3 months journey now.
Almost there.
I think the first month and a half, I saw a lot of improvements just with this by itself. We had like bed bugs, so I was sleeping really poorly for like a month, and I noticed my symptoms get worse. And because I was drinking more caffeine, that's when I cut off caffeine. And then once I cut off caffeine, I saw a big surge in my improvements. And then I realized, okay, fixing this, fixing the root cause of my problem allowed me to heal like 50–60% of the way. But the thing is, like, all these things that I've tried before, like having humidifiers, sleeping on a firm bed, physical therapy, stretching, all these things I did before didn't help prior to installing the orthotics. So, I'm really glad I went through this process. Yeah, I mean, this was the root cause of my problem. Yeah, I had a bit of unrealistic expectations because I would see your 10-minute patient videos and kind of expect a immediate result. So I was kind of hoping like to get to 80–90% improvement within like a week. So I was a bit disappointed when my symptoms got worse towards the middle of it, but then I realized, it's because I'm sleeping poorly because of the bed bug. And because of that, I'm drinking more caffeine, and that's causing everything else to get worse. So then once I figured that out, and and then all my symptoms started getting improved, getting improvements, and then you know, the other treatments finally also clicking after the orthotics. Yeah, it's met my expectations. Like I'm pain-free. I can focus on work. You know, I'm a much better dad, much better husband, son, brother, so financial advisor. So yeah, I'm really happy.